Vanessa Sandburn. I'm the Executive Director of Let's Talk, an organization based in Kansas that provides comprehensive sex education to schools and communities. We've been supporting Topeka Public Schools for the last year and will be providing comprehensive sex ed and freshman health classes this coming year. The purpose of this video is to provide you information about what your child will expect in their health classes. The themes covered are based upon the National Sexuality Education Standards. The programming goals include helping students think critically about sexual decision-making, to recognize the physical and emotional risks to sexual activity, as well as contemplate their own values and those values of their partner when it comes to choosing to engage in or to delay sexual experiences. Helping every student understand their rights to refuse sexual experiences, as well as their responsibility to listen when potential partners fail to enthusiastically consent to sexual activity. We know that teens experience a great deal of pressure from peers and partners when it comes to sexual activity. Our programming is geared to improve the chances that students are successful in making consensual and healthy sexual decisions that are in line with their own personal values and with those of their partner. Our presentation also helps students explore sexual identity while supporting students in accepting themselves and others as they are without feeling the need to conform to societal stereotypes about gender and sexual orientation. We also aim to provide access to practical information, such as understanding how to properly use a condom, being aware of contraceptive options, knowing where to go to obtain low-cost reproductive health care services, including testing and treatment for sexually transmitted infections, and helping connect students to resources, organizations, and clubs that can affirm their identity and provide support as they navigate relationships and adolescence in general. We start just with some warm-up activities in order to engage the students and illustrate that we're here to have fun. So we ask them who woke up earliest this morning, who was born farthest away from Topeka. We find out who the youngest person in the room is. And then we ask who got the most sleep last night. And here we typically do a plug for sleep because teens are not getting enough of it, and getting 8 hours of sleep a night as recommended will help improve both emotional health and physical health. We start with one of the most common questions that we receive, which is, what is sex? There are a lot of ways people might choose to express sexual feelings, and not everyone has the same definition for what sex is. Through the course of this program, we'll talk about consent and health in the context of this broader definition of sex. Sex is also a small part of this broader concept of sexuality, which is important to understanding ourselves and how comfortable we are with these concepts. Gender identity, intimacy, personal feelings about one's body, attraction and how that changes over the course of a person's life, and personal values and how those values influence all of those themes and comforts with the different sexual activities are all really important things to consider. Next, we talk about the gender unicorn, which is a graphic put out by the Trans Student Educational Resources website. More information can be found about this graphic online at the website listed at the bottom of this graphic. This provides us an opportunity to talk about different components that make up individuals and answer a lot of student questions around gender identity and sexual orientation. Next, we show a YouTube video by Teen Line, and if you would like to watch it, the YouTube link is listed there at the bottom of the screen. Another really common question we get is, how do you know when you're ready for sex? So we ask the class if they think that this question is easy to answer or if it has the same answer for everyone. We also like to switch this question to something more simple. How do you know when you're ready to go swimming? and we have the class brainstorm everything that they need. People will say goggles or sunscreen or nice weather so that the pool is open, and a whole laundry list of things that are necessary in order to ensure that they're going to have a really fun time swimming. We like to point out that not everyone's list is the same. Not everyone needs goggles. Some people have access to indoor pools. There's a whole lot of different preferences that people might have when it comes to swimming and personal preference. So then we tell them that answering the question about how you know when you're ready to go swimming is not all that different than answering the question, how do you know when you're ready for sex? What is important and meaningful to you may not be the same as for everyone or for someone else, but that doesn't mean that you aren't entitled to needing to have particular things met in order to be ready. The answer to this question varies a lot from person to person. It's determined by a combination of factors. So we talk about state law and what the law says. We talk about personal values and beliefs, what someone's personal values or religious beliefs or family values might say about the answer to this question. And then we talk about the values and beliefs of your partner, because that is something that has to be taken into account as well. We highlight that thinking through this question critically and logically and thoroughly helps make for better decisions. And then we let them know that we have two basic guidelines that can be utilized in order to better answer this question. The first is asking, is it consensual? And the second is asking, is it healthy? And so we talk about consent and what sexual consent means. We also talk about the difference between giving consent reluctantly or giving enthusiastic consent. And give an example like what it would be like if, say, your parent asked you to unload the dishwasher after school. Nobody would be so excited to do that, but they might agree to do it because they know it's important to help out the family. For helping out with a chore or doing your homework or something else like that, reluctant agreement is fine. But when it comes to intimate activities with a partner or any kind of sexual activity, reluctant agreement is not sufficient. Enthusiastic consent is necessary, and raising the bar helps ensure that we are truly giving consent to activities. Next, we show a video that helps describe consent using the analogy of offering someone a cup of tea. And if you would like to watch that video, the link is provided below. And then we move on to asking, is it healthy? And we ask the class what they think we mean by healthy. We have a collage of different images that help describe this concept. That first graphic is what HIV looks like under the microscope. HIV is one of about 10 sexually transmitted infections that people in the United States ought to consider when thinking about sexual decision making. About half of people will get a sexually transmitted infection at some point in their lives. We'll talk more about those infections later on in the program and also talk about preventing sexually transmitted infections. The next image is a positive pregnancy test. About half of pregnancies in the United States are unintended, meaning that people did not set out to get pregnant, but end up with a positive pregnancy test and the challenges that that kind of situation requires. Then the final graphic down below has to do with a broken heart or dissatisfaction with relationships or regret about sexual experiences or emotional stress that might come from making choices about sex that are not in line with a person's personal values of what they want when it comes to sexual decision making. And so taken together, all of these things really represent that question, is it healthy? We're going to focus now on pregnancy and how pregnancy happens. The two ingredients necessary for a pregnancy are a sperm and an egg. People who make sperm make about 1 million sperm almost every day. People who make eggs make about 1 egg once a month. Learning about the different body parts associated with these cells is an important thing in order to understand how pregnancy happens. And so the next thing we do is focus on the body parts associated with people who make eggs. We hand out a worksheet similar to this graphic and have students work in small groups to label these parts. After given a little while on a friendly competition, we go through the answers to these questions. And so we go through the external anatomy first, and then we go through the internal anatomy next. We follow this by a similar activity with the body parts that make sperm, and then go through the answers. And then we show this diagram, which essentially is showing when an egg and a sperm find each other, kind of 9 months later, what that looks like. And open the class up to questions about pregnancy, labor and delivery, anything like that that they're curious about or want to know about. We often answer questions about twins, and then we reorient them to the body parts that they just learned about in the previous activity, about where the uterus is, where the cervix is, and kind of how the process of labor and delivery begins. So this typically ends our day 1 of programming in class, and we hand out these cards. These cards advertise our Let's Text program, where students are able to text in this number any question that they might have about the content we covered today, or additional support or information that they might be curious about, so that one of our educators can respond to their question with the answer. It's not a traditional texting service in that we don't see the phone number associated with the question that comes in, so it protects the confidentiality of the person using the service. We found when speaking with teenagers that confidentiality was a really important thing in order for them to feel comfortable asking questions that might be sensitive in nature or that might be embarrassing. And so this service allows us to just see the question from the person that texts it in without knowing anything about their identity. And then we can reply with the answer to the question, or an internet article, or an online resource in order to better meet their needs. And so we begin day 2 talking about how to prevent pregnancy and how to prevent sexually transmitted infections. The mystery box is a small box that we have with various contraceptive samples in it, and we take that around the class and ask people who are interested in playing to reach in and take something out without looking, and then figure out what it is and how it might work, and basically guess and share that with the class. And then we walk through each of those methods and give more details about pregnancy prevention and preventing sexually transmitted infections. We put this graphic up on the screen, which talks about the methods that are available to help prevent pregnancy and how effective they are. And so this is showing the 3, 4, and 5-star methods of contraception that are available on the market currently. We talk about how abstinence is the only 100% effective option at preventing pregnancy and sexually transmitted infections, but how there are quite a few methods available to help decrease the risk when people do choose to become sexually active, and that those methods vary in effectiveness based upon usage most often. And so without any birth control methods, over 90 out of 100 young women would get pregnant within a year if they are sexually active. Using that blue line of methods, the 3-star methods, roughly 12 to 24 out of 100 would get pregnant within the year. The green line of methods, those 4-star methods, roughly 6 to 9 out of 100 women get pregnant within a year with typical use of those methods. And then the top category, the 5-star methods that are very effective, that orange line, roughly 1 or less than 1 actually in 100 women would get pregnant within a year's time if they're using one of those methods. And so we have examples of most of these that are part of the mystery box, and we walk through and talk about how they're used, how they work, and where someone might get those methods. When we talk about condoms, we also talk about how while condoms show up there on the bottom line, the only 3-star, not so effective methods, part of the reason they're there is because people that choose to use condoms as their primary birth control method don't always use them consistently. And consistent use, in addition to correct use, are both really important in order for condoms to be effective. However, when condoms are used consistently and correctly, they can be up to 98% effective at preventing pregnancy, and they're also the only method on this diagram that also help to reduce the risk of sexually transmitted infections. And so for that reason, it is important to understand and know about how to use condoms effectively. We also focus in briefly about fertility awareness because we often get questions about this method from young people who have misconceptions about how fertility works. While people who make sperm are fertile every single day, people who make eggs are fertile on more of a cycle, which is somewhat predictable if you pay attention to certain things in your body. And so we talk about how that menstrual cycle works and how ovulation tends to work. We also talk about how relying on this method for birth control can be not effective, which is why it is a 3-star method instead of a 5-star method, because ovulation can be irregular, especially early in life as people are developing their menstrual cycle and becoming more regular. But there are quite a few apps that people with smartphones can use in order to track their cycle and predict when fertility is most likely. Okay, the next thing we do is talk about consistent and correct condom use, playing a game about the 7 steps to effectively use a condom. Here are those steps laid out from the first to the last. Students get into groups and then put these cards in order from the first step to the last step, and then we walk through what each of those steps mean and provide some more information about correct condom use. The next activity is a true or false game around sexually transmitted infections. There's a lot of misinformation out there around how sexually transmitted infections are spread, and this game gives us an opportunity to dispel some of those myths while engaging the students. Here are some examples of the statements that they read, and then answer whether or not it's true or false. Typically 16 students can play. We have 16 cards that we pass out in the classroom, and then one by one they read their statement and then say whether it's true or false. And then if they get it right, we congratulate them, and if not, we correct the misinformation and then usually provide some more context from the cards. We found that this is a really high engagement activity with lots of good attention, and oftentimes there's quite a few follow-up questions as well. And then we talk about the 3 categories of sexually transmitted infections that affect people. There are 10 common infections that people have to deal with here in the U.S., divided into these 3 categories. And talking about them in these categories helps to describe treatment options, which ones are curable, which ones are treatable, and just provide some more general information about how these sexually transmitted infections impact humans. Next, we talk about access to healthcare. So in the Topeka area, the health departments have outsourced much of their medical care to the Grace Med clinics, which do provide an option for people without health insurance or people without a family doctor to be able to go and get access to testing and treatment for sexually transmitted infections. These clinics have limited access to contraceptive methods, but we also talk about how most doctors' offices, family doctors can all provide reproductive health care services to their patients. Our final activity circles back to those two questions that we asked students to contemplate earlier in the presentation. Is it consensual and is it healthy? And we actually do some scenarios to determine whether or not these questions are answered appropriately. And so we work through 5 different scenarios, asking the students to kind of read the scenario aloud, and then we tell them to, put on their social worker hat or their nurse hat, or maybe consider that they're a friend of the people in this scenario and talk about, is this consensual? And we're talking about enthusiastic consent. Is this healthy? And then what advice they have for the people involved. And so we work through these 5 scenarios and answer those questions, ending with this last scenario, which really describes what sexual assault often looks like in the real world. Students are able to identify that this is not a consensual situation, also that it's not a healthy situation, and then we talk about advice. Oftentimes that brings up a discussion about who's responsible for this situation, and that's a really good discussion to have in a class. We talk about that if you are Paul's really good friend, what advice you might have for him would be to not go to this party, but at the same time, we talk about how the causes of rape are not going to a party or wearing a particular outfit or not using the buddy system, but rather the fact that people are not respecting enthusiastic consent. So we want to make sure that we're holding Alice in that scenario accountable for that situation, which is a really good discussion in the classes. Students today are much more open and willing to discuss consent in the context of holding rapists accountable as opposed to blaming victims for that kind of situation. And then we talk about media and the media messages that often people receive. So if you had a chance to watch the Consent T video from earlier in the presentation, you will have seen that it really presents consent as a very black and white issue. You either have enthusiastic consent or you don't. And that is an honest, great way to view that concept. However, if you layer on a lot of the media messages or cultural messages that young people might receive, then oftentimes it's not presented quite as black and white as that. And so these are a couple examples of advertisements that were actual advertisements that people might have seen that really make a lot more gray area when it comes to consent. And so we break these down and talk about it, and we talk about how if you live in a culture that makes it seem as though sexual assault is maybe a fun way to sell clothes for Macy's department store, then it becomes harder to really see consent as a black and white issue that it needs to be seen as in order to decrease rates of sexual assault in our world. And then we end with some kind of tongue-in-cheek rape prevention tips that help really contextualize that message around holding our own selves accountable for our behavior and never pushing someone to do something that they aren't interested in doing in an enthusiastic way when it comes to sexual activities. And so we read through these and talk about how these are very different than traditional rape prevention tips in that they are holding rapists or potential rapists accountable as opposed to victims. And that is how we end our presentation. Lastly, we hand out surveys to all students to allow them to provide comments and suggestions for improvement for our future programming, and also just assess their satisfaction with our program so we can report that to any grant funders and learn how to improve the program in the future. Thanks for watching.